talking about is the idea of wellness and resilience and moving from burnout to resilience. So a quick kind of review of what the literature says, and we will take a look. This is the objective is we're going to look at the risk of burnout, the factors that lead to burnout, look at some interventions to prevent burnout and increase resilience. And then the goal is really to help you develop kind of a personal plan and perhaps even an organizational plan to increase resilience in yourself and those you work with. No one pays me to do this stuff, so no conflicts worth mentioning. And it's important to just start off with the fact that no matter where you are in this system, no matter what your particular background or role is, medicine is a stressful career. And to any of us, even the toughest, hardiest of us, you can get to the point where you're just overwhelmed. So this is just a quick couple-minute video from Doc Vader here.
Every day, you know, I'm forget it. You know what? I don't care if people are watching right now. I'm going to tell you exactly what I think. What I think is in 2017, okay? What year is it? In 2016, it is not easy being a doctor. It is not easy being a nurse. It is not easy being a respiratory therapist. It's hard all around. And everyone the patients think we're having this great life and we're playing golf and we're eating cake. There's no cake, people. There's just feces and stool and administrators and government, everybody up in our exhaust port, up in our metal grill, telling us what to do. I ain't got time for it no more. Beta is out. I'm going back to business school. I'm going to get an MBA. I'm going to run a hospital and cash money millionaires. Do you know what a nice dinner for me is? I take my family to Outback Steakhouse. We get an awesome blossom. And maybe if we're lucky, if we've saved up and we've paid off our student loan payment that month, we'll get a dessert. That's what an awesome dinner is. But we'll just get one dessert to share among the four of us. Okay? Leia, Luke, me, and Padme's ghost. We share one dessert. One. Nobody. And then they're like, oh, you're rich and you're in farmer's pocket and you're vaccinating. Yes, we're vaccinating because we care. We care about you idiots. And you want to throw it back in our face. You know what? Go to hell. Go watch your Jenny McCarthy. Go watch your Dr. Oz. Just go and shove it in your exhaust port because I'm out. I'm done. I'm going to take my family tonight for one more dinner at Outback Steakhouse, and then I'm going to business school so I can screw everybody in the... I'm so broke, I consider Red Lobster to be upscale. All right?
So anyone can get to that point where you just can't take it anymore. No matter how much you've enjoyed your career, you feel burned out and overwhelmed. This is just a quick couple of statistics. There's lots of studies out there looking at physicians, and almost all of them are going to say between 40 and 50% of physicians are burned out at any one time. It's worse in the emergency department. It's best in dermatology. But all throughout the medical career, you're going to run into burned out physicians. But it's true of every career field as well. This is another one looking at physicians and just saying, yeah, people in society in general are burned out, but you're much more likely to be burned out if you're a physician than if you're doing some other kind of job, except in the medical field, because those folks are equally likely to be burned out. This is a study of social workers in the New York City area. 57% of psychiatric social workers were moderately to severely burned out. 71% of those working with family and children. And you might think, well, that's New York City, and of course you're going to get burned out in New York City. But another study in North Carolina, again, 40% of those social workers were experiencing burnout presently, and 75% had experienced it at some point in their life. Nurse practitioners and physician's assistants aren't immune to it either. This is a study out of Tennessee. A quarter to a third of them experiencing burnout as well. It's not just an American problem. This was a study of a large hospital in Taiwan. 66% of the nurses were experiencing burnout, 62% of physician assistants, 39% of physicians, 36% of administrators, and we often don't think of those folks as experiencing burnout, but they do, and a third of the medical technicians. So it's pervasive. Everywhere you look in medicine, you will find people who are burned out, and it has a tremendous impact. One of the things it does is it leads to provider turnover. That idea that I just need to leave here, I'll find someplace else, I'm sure things will be better, the grass is always greener, and so people up and leave their job. And that's an expensive proposition. I could find data on physicians, and their estimate is that every time a physician leaves because they're burned out, it costs their hospital system $250,000. That's decreased productivity, the cost of looking for kind of a replacement, moving packages, all that kind of stuff. It's a sizable amount of money, but there are other consequences as well. Decreased productivity, there's just fewer people to see patients, and those burned out providers aren't working as efficiently, they're not working as well. Patient satisfaction decreases with burnout, the quality of care decreases with providers who are burned out. You see increased numbers of medical errors and increased mortality. Because when you're burned out, you're just not attending as well, you're not focusing as well, you're not going to do your job as well, and the patients are going to suffer. It also leads to physical problems as well, elevated blood pressure, weight gain, anger, depression, anxiety, and decreased quality of life. So it's a real important issue. It's an important issue for everyone on this call of identifying burnout, addressing that tendency toward burnout in yourself and with your fellow workers. But I haven't defined it yet. You'll see various definitions of what burned out means. This is probably the most acknowledged, the Maslach stuff. They started this in 1981, and they identified 3 different domains of being burned out. And the first is emotional exhaustion. This is just tiredness. You're completely drained. You're feeling like you have nothing left in the tank to give. And it's often associated with emotional lability, tearfulness, or anger or irritability. But that's just one of the domains, that emotional exhaustion. There's also depersonalization, that tendency to step back from patient care. You develop negative or cynical attitudes. It feels very impersonal. You're no longer relating to people. You're just seeing the next depression or the next schizophrenic, or you're just treating them as if they're just numbers. You're treating them as objects. That's another symptom of burnout. And then a lack of a feeling of personal accomplishment, that sense that you're not doing your job very well. You're inadequate, you're inefficient. I know I'm not doing a good job, and you aren't. But that too comes with people who are feeling burned out. So let me ask, without naming names, if 1 or 2 people could unmute, how common is burnout at your workplace? And you don't have to tell us where you work. We're not looking to diss anybody, but is this something you see a lot? Is this something that's fairly rare? Is this something that's ubiquitous? How often are you seeing burnout where you work?
Don't be shy, folks. I know all of you are seeing it somewhere.
All right, I'll pop in. It's Amy Lackritz. I see it in my husband, a neurosurgeon, and I also saw it in my office. So, it just, he is just complaining about, being on call and the calls and people bothering him and having to get up and taking calls in the middle of the night. And, he's at the end.
How about the community mental health world?
I see it as I am a community health worker, and I also see it as I actually work in the finance department at a treatment facility, and I see it in the counselors all of the time. I mean, they after like 2 or 3 years, they just need a break. They come in and they work really hard working with people who have different problems, and by the time they counsel them for their AOD issues, but also they have to be their case managers, and so they continue to have to help them find housing, do different things, and they are really available to them 24/7 because they serve the role as a case manager and a counselor. And after about 3 or 4 years, those people who were there that were really, really gung-ho and very, very enthusiastic about helping clients it seems to go away for a minute. I mean, some of them like go on 6 months, take 6 months off and come back, and they come back all right, but they do suffer from burnout.
Yeah, thank you very much. Now we're going to take a look now at what causes it. There we go. This is my own little chart, 4 different quadrants we're going to take a look at. We're going to start with personal factors and work our way around, because there's a lot of different things that can lead to any particular person being burned out, and some of them are personality traits or personal factors. I'll throw this open. What kinds of things are more likely to make people burned out? What kind of people are more likely to burn out?
Caregiving types.
Right. The more you give of yourself, the quicker you are to feel drained. Sure. What else?
Perfectionists.
Perfectionists, right? If you're not able to let it go, if good enough is not good enough for you, then that's going to be a problem. Any others?
Save the world people. So people who are like, I'm going to fix all of these issues when their scope is much smaller than that.
Right. Perfect. So perfectionism and an inability to say no, I think that goes along with what Tessa was saying, that inability to draw boundaries and say, this is my responsibility. I just can't do everything. Being isolated, poor health, problems outside of work. If you're having marital issues or your parents or your children are having health issues and things are distracting you, all of those things make you more likely to burn out. There's a lot of things in the workplace, and these are some of the obvious ones, right? Workload. Just having too many people that you're responsible for. Shift work, especially if it's variable shift work. If you're working, mids one week and then next week you're working days and then the week after that you're working, nights or whatever. If that's shifting around, that's tough. That's just physically difficult. Lack of resources, lack of support. And whether those resources are administrative resources or coworkers, there's nothing more discouraging than you're having to do someone else's job because there's no one else there. And you're just having to do your own work and then pick up their work as well. Those things will lead to being drained. Inefficiencies, inefficient systems, and increased clerical burden, right? This was the promise of the electronic medical record this is mostly for the medical students because I'm going in the Wayback Machine. So when all we had was paper and electronic medical records started coming along, everyone said, this will make our lives so much easier, because all you'll have to do is click a couple of buttons and the work will be done and it's going to be quicker and it's going to be more efficient. And just the opposite has happened. The more electronic medical records are out there, the more things we have to fill out, the more things we have to check. And the clerical burden has actually increased quite a bit since electronic medical records hit the scene. And that's not why we entered medicine. That's not why we became social workers. That's not why we became nurses. We didn't become a nurse so that we could click boxes. We became a nurse so that we could help people. And we're being taken away from that and spending time on our computers more and more. And that's draining for people as well. Now, this one is tough because I don't want you to talk about, where you work now. Again, we're not here to air any dirty laundry. Maybe talk about a place where you used to work or something vague. But what can organizations do to burn out its providers? So we've talked about the person. We've talked about the workplace. Now we're talking about the overall organization. Some organizations are great at this and help their folks become very resilient and very hardy and work really hard. Other organizations just burn out people and they just turn over folks every couple of years because it's really tough to work there. What are the organizations doing that are burning out its providers?
I came from another job where there was a lot of burnout. And so administration, I think, thought if we just give more money to the people, that will make burnout less, but that really didn't help. People, I think, need like vacation time and things like that. I think that would help.
Yeah, so that's a great answer. So feeling that money is the answer to all problems when that's not necessarily the case. Great. There was someone else was trying to answer there too.
Well, it was just me.
Sorry.
Go ahead, Barb.
Barb and then Sarah.
Poor communication,
yeah.
So that people don't understand what's happening and why it's happening. So there's a lack of trust and what is going on. Why are they doing this and that and that and this?
Yeah, great. Sarah, you were going to say something too, I think.
I was lack of control. So having the employees feel like things are happening to them and that they don't have any input or ability to really react in any way, that things are just acting on them.
Great, and you've hit most of my points there, so that's fantastic. A lack
Randy,
of
real quick,
Pat
had a comment too.
Yeah, go ahead.
I had worked at a place where we kept losing psychiatrists, and they had tried using a locums and it was really a disaster. So when we lost somebody again, several of us pitched in, but we were working an incredible amount of hours and we wanted to keep the organization afloat. But there wasn't really any acknowledgement of how much we worked and how really difficult it was. And ultimately the agency did go bankrupt, but and they rewarded some of us by not paying us for 3 months. So it was really quite a sad situation.
I've got one other quick comment, because I think some of it is modern systems theory, I think, is doing it. And what I mean by that is, and we've even talked about it in our own integrated care team, even prior to the echoes, was trying to have everybody work, quote, at the top of their license. And the reason I think that's concerning is that I didn't go into psychiatry to only see the most ill people who are about to go into the hospital. And I think most of us in whatever profession didn't choose that. So I would be amenable to that if they gave you a lot more time per patient to see those really challenging people, but the systems haven't aligned to that. They're like, okay, Dr. Welton, you're only going to see serious and persistent mental illness no matter where you work, and you still have to see them in 20 minutes. So to me, I think there's a systems alignment that hasn't matched. If we want to do this work at the top of your license idea, they have to, like if you go to a specialist in medicine, they can spend an hour with you and they get reimbursed well enough to spend an hour with you. So they can see 8 or 10 people a day, whereas psychiatry, social work, nursing, LPCCs, et cetera, that's not the case. You're going to spend a lot of time, you're going to spend short time with a lot of people. So just my other input in terms of what's going on in the modern world.
No, and those are absolutely right. So one of them, and this is looking through the literature, you'll see misalignment of goals. You've joined up because you want to help people. You want to take care of people, but you have the sense that your organization has some other mission. Maybe it's to make money or become famous or prominent or market share or whatever it is. A lack of appreciation. Patricia had mentioned that. Not allowing you to pursue your career interests. Doug had mentioned that. Forcing you into a little hole, or making you do one thing over and over rather than letting you see more broadly the patients you would like to see. Poor compensation, or just giving money, throwing money at it. That had been brought up. A poor mixture of responsibilities. Again, that idea of pigeonholing you. Excessive administrative demands. Inconsistency. That goes along with that communication. Where this is the policy one week, and then next week, for some reason we don't understand, suddenly things are really different. And I think we've all experienced that. And the last of these kind of basic categories is our intrinsic factors for you as a provider. And some of these have already been mentioned too, that lack of a sense of autonomy and control, where I no longer control my schedule. I no longer am in charge of who I'm seeing or how I'm seeing them. One of the factors that's really interesting is when experienced stress exceeds expected stress. So if you go in and you're going to have a crappy day, and it turns out to be a crappy day, you're okay, you're fine. But if you go in thinking you were going to have a good day and you had a crappy day, that will disillusion you. That will drain you really quickly. And the more often that happens, the more likely you are to get burned out. And finally, an intrinsic factor is no longer finding it satisfying. You just feel like you're a cog in a machine. You're not taking care of people. So what do we do? What do we do to increase wellness? And wellness is more than just not being burned out. Wellness is not being burned out, but it's also a sense of resilience, a sense of energy, enthusiasm for what you're doing. So how do we get people to this state, where you're dancing through a field with flowers and you feel healthy and you feel like you're thriving and you feel challenged, but in a good way? How do we get there? Well, we're going to look at those same 4 areas again and kind of go over some things. And as I'm going through the list, what I'm going to challenge you to do is to ask yourself, which of these are in your control? And then which of these can you work on with others that you as a work site, you as an organization work on? So what personal factors can be modified? Well, we know this list, right? This is what we tell our clients. This is what we tell our patients. You should exercise regularly. You should sleep properly. You should develop social relations. You should take vacations. You should limit volunteering. Those are all true. Those are all accurate. That's what we tell people to do, but often we don't do them ourselves. When you look at the literature, if you look at modification of personal factors, it's things like creating priorities and balance, being able to set limits. Say, I will do this, but I'm not doing these things. That's not my job. Learning to say no, not always volunteering for additional work. Developing a life outside of work, having hobbies, having friendships, having things that you do that are fun, maintaining sleep hygiene, increasing support network, developing some positive coping strategies. It's, see things as, rather than obstacles, you see them as challenges that can be overcome. Exercise, mindfulness, we know how to do these things. So kind of become aware or keep aware of your emotional state. How stressed are you feeling? How sad are you? And then develop some responses. I know what to do when I'm feeling stressed. I know what to do when I'm feeling anxious. Not only do I teach others to do relaxation exercises, but I do it myself. Now, so I've said all this, and every one of you could have given me that same list, because we know this. This is what we tell our patients. This is what we tell clients to do. The problem is we are terrible at doing them. Why is that? If we know these are good for us, why is it so difficult for us to do them? Time. Yep. It's just, it takes time, and we feel we never have enough. Okay. Other reasons?
I think sometimes it can feel like another obligation. Even though we know it's going to take care of us, it's going to make us better. It's like, I have X, Y, and Z to do, and you're telling me to do self-care on top of it.
Yeah, so you give me another 3 hours in the day and I will exercise and I will sleep better. But where am I? Yeah, but otherwise you're putting this burden on me to make myself better. So time, that sense that it's an obligation. Other thoughts? Pride can come in there. That's for weak people. I don't need that. I'm at the top of my game. I shouldn't need to take time off. I shouldn't need vacations. I'm the most important person here in this building, so I need to keep working all the time.
So a long time ago, when I was in grade school or younger, I used to take piano lessons, and my piano teacher said something to me once that kind of has always stuck with me. She said, you always make time for things that are important for you.
Yep.
And that was the last piano lesson I ever had, whether it was a good thing or bad thing. But that's kind of stuck with me, that sometimes it's that we value things in an abstract way, but when it comes down to things, it may not be as valuable, as important to us as it needs to be.
That's right. And these things are helpful. But as kind of mentioned, as Amy was talking about, it does kind of give us a sense of obligation. They've done a meta-analysis, 19 studies, looked at 1,500 people. And when they addressed personal factors, when they made themselves exercise regularly, or they made themselves stick to a sleep schedule or whatever, it did reduce perceived stress, but it was only a small impact. So the effect size was small. So it does something. It does help. But you can't yoga away an unreasonable schedule. You can't, just by doing yoga or relaxation exercises, that doesn't take away if you're working 12 or 14 hours. So personal kind of control is important. It is good to do something, but it's not the only thing. And we really start needing to look at extrinsic factors. And there are some of these, again, that might be in your control. Limit workload. Well, maybe you can do that. Maybe you can bring that up as a group or start pushing that, but there are other things you definitely can do. Work on good communication skills, make sure that your team is working effectively, that you all talk, that you all share, that you all know what's going on in each other's lives and you can support each other, because those supportive relationships at work are essential. It is so much easier to go through a really difficult time if you're going through it with a team of people who are going through it with you. When you have to do it by yourself, it's miserable, and everyone knows that. Improving your clinical skills. My life would be so much better if I had ever taken a typing class. But it was just one of those things where I said, well, I don't have time to learn how to type. And now I'm old and it's hard to learn new things. And I've probably wasted years because of my very slow typing. If I had learned to type faster, I would be done much, much quicker than I am now. So improving your clinical skills, workflow designs. I hate it when, you're being Epic and they come out and all your templates are gone because they've updated it or whatever. But learn how to use those electronic medical systems for your benefit and learn how to use them well. Those things help. Get organizations to show appreciation, to limit workload or at least make it reasonable, to adjust compensation so that you feel rewarded for the effort, to increase support. One of the things that was really an interesting idea was to, actually it's on the next slide, to allow providers to do something that they want to do with some percent of their time, maybe 10%, maybe a half day a week or a day a week, to pick their own job. Now, it still has to be related to the organization. It still has to be productive. But maybe there's a type of patient you would like to deal with. As a psychiatrist, for example, I've went into organizations and I've said, you know, I want to do med stuff, but I like doing therapy. Doing therapy is important to me. If you want me to come work here, you need to give me a half day a week or a day a week when I'm allowed to do therapy, because that's important to me. That kind of flexibility can help develop resilience. Allowing folks to have some flexibility and autonomy. And what they find, the personal things, doing stuff like sleep and exercise, that helps a little bit, but organizational efforts are much more effective. They have a medium effect size on resilience and burnout. So when you can get the organization supporting people and helping you, that's when you really start to see everyone do better. And the last of these areas is that intrinsic factor, your motivation, your satisfaction, your sense of purpose, the sense of calling. And one of the things that keeps us from feeling that sense of satisfaction is because our lives are a lot different than what you expected. Whatever your career field is, how is the reality different from your expectations? What's different about your professional life from what you expected it would be?
I trained back in the day when we trained to be psychotherapists. And my first 10 years of private practice, I never prescribed a medication. And so this is totally different. Now, I like working in the public sector, so it's difficult for the agencies to let a psychiatrist do the therapy at times, but I hear what you're saying. When I was able to be more in a chief clinical officer position, I was able to learn all kinds of new treatments and to be part of the system of care and things like that. But a lot of those jobs have gone away. So it's you know, it really changed over the years. Now I basically assess and do medication, but work a lot with staff on treatment. But doing the psychotherapy in the public sector is really almost impossible.
This could be like a social work thing, but just the sheer amount of knowledge I need to have in my head at all times. Like, yeah, I need to be able to be a good therapist, and that's like my driver and my biggest thing that I do. But if I also don't happen to know what this medication does, or where they can go to the food pantry, or how they can get their rent paid, or where they can get some clothes, then I'm not addressing the needs of my patient. And they somewhat prepare that for you in school, but I think until you like are face to face with someone who has $60 in their bank account for the rest of their month, you can't understand it.
So you expect to be an expert in one area, but not in all of the areas. Others? Major differences?
I started working at Portage Path as a nurse practitioner fellow this year, and so I'm a new grad. Like, this is my first year working as a nurse practitioner. So I was working as a psych RN, and I don't know, I kind of had this idea that I don't know, I guess, you know, you kind of expect, you know, the increase in responsibility and everything, but similar to what she was just saying, you don't really know until you get there. So just that like overwhelming like sense of responsibility for all of these patients and trying to make sure you're making the right decision for them. And they do expect you to have all the answers, kind of. So like, it's kind of hard to balance that sometimes and say, you know, sorry, like I don't have all of the answers, but this is what I think is the best plan if you're okay with it. And I don't know, not letting everything weigh on you so much. It can be tough.
The lack of, oh, go ahead, someone.
Yeah, if I could just throw in that, you know, working in community mental health, once I became a middle manager, all of a sudden I was expected to understand local politics, business, financing, you know, how the Medicaid and Medicare systems work, stuff that they certainly never taught me as a counselor.
Right. Yeah. And so this is just my my free association list here. So lack of control, the long hours that it takes, the entitled and demanding patients, entitled and demanding families, increasing paperwork, insurance companies. That is something that, you know, like I worked with psychiatry residents for a long time. They're never prepared for because we protect them from that mostly. And then they hit the world and suddenly, what do you mean I have to call these people? Yep, you have to call them. Isn't there someone else to do that? Nope, it's you. That's quite a wake up for them. Restrictions on practice, lack of resources, all of that can kind of be a slap in the face. This is my next to last slide, so don't worry. But how do we regain it? The world is what the world is, right? There are regulations. There is all this paperwork. There are, you know, all these things we have to do. Practice is changing. You have to be an expert in everything. How do you regain that sense of calling, that sense of purpose, that sense of significance? How do we find meaning in our work when we are so often overwhelmed and tired? Any good suggestions for that? I don't have an answer for this one, by the way, so you're going to have to come up with something for me.
For me personally, it is when the patient says thank you, and they've acknowledged that what I have done has helped them, whether it's an ear infection or medication for, you know, the anxiety and the depression is working and they're feeling so much better. It's taking those small things and recognizing that, yes, I do make a difference.
Reveling in the small victories. Yeah.
Correct.
Good. Any other suggestions, advice?
I think when you look at this idea of calling, if you're already in the midst of it and inundated by it and drowning in it, you can't hear a calling. And so that's why it's so important to do a vacation, to vacate from what you're in the midst of. And that doesn't mean, oh, I got to schedule 2 weeks or a week. This has just as much to do with actual vacations with margins in the schedule. It can be as setting up leisure time, whether it's a weekend or a long weekend. You can actually still have vacated moments and margins in your schedule when you're still working 40 hours a week. It's not easy, but you can do it. But it's hard to experience a calling when what you've been called to is you feel like you're drowning in, and you almost have to separate yourself and get into the habit of doing that, and not necessarily just once a year, but that being kind of a lifestyle that you're able to build into. All of that's easier said than done. Don't ask me how to do that. Just that's what you're supposed to do.
No, that's a great. Yeah. How do you take those mini vacations? How do you turn your cell phone off for the night, or stay away from emails on a Saturday? That's sometimes really difficult. So, well, I'm going to leave it there, because I don't know you well enough, and I don't know your situation well enough to know what you need to change, what you need to do differently. But I will leave that to you to take a look at your workplace, take a look at your personal lifestyle. What can you do differently? Do you need to develop a hobby? Do you need to start saying no to people? Do you need to start setting limits? Do you need to talk to your supervisor about what you're being asked to do? But I'm just going to encourage you, whatever needs to happen in your situation, that you take time to do that. You know, many of I'm not going to ask, but I suspect many on this call have been in that burned out place, and it's miserable. You've spent a lot of time and effort and energy and money to get to where you are, and to suddenly lose the joy of what you're doing, it makes life really miserable, no matter how much you're getting paid to do it. So take time to take care of yourself. There's a great story, I think, from Abraham Lincoln, who said, if I was told that I have 4 hours to chop down trees, I'd take the first 2 hours to sharpen the axe. That we need to sharpen our axe. And the way you do that is by taking care of yourself and taking time. So thank you all very much. I will stop sharing now.